بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الله الأمين أما بعد السلام عليكم ورحمة الله وبركاته. And today I would like to talk about a research entitled Eating Out Increase the Risk of Females Exposure to Toxoplasma gondii infection in Mogadishu, Somalia. And the time we have is very short. Let's directly. Okay, this will be the introduction. Toxoplasmosis or cat disease is a zoonotic and congenital caused by a single species of a complex and protozoa called Toxoplasma gondii. It is unique public health importance and its management in females infection during or just before pregnancy and the immunosuppressive people. Transmission. This infection transmitted by ingestion the tissue cyst or oocyst in contaminated food, water, or soil. Over 1 billion people in the world are infected. 40% up to 52% was reported in Somalia. Risk factors of toxoplasmosis. In general, socioeconomic, geographical, and climate, food habits, hygiene, and management systems of food animals play important roles in epidemiology of the disease. For Somalia, the close association the close association of humans and livestock, socio-cultural practice, and poor hygiene. Different significant factors were reported in the global. More than 1 million cases of toxoplasmosis in Europe caused by a contaminated food every year. Hassan et al. Analyzed 17 risk factors in pregnant Somali women, and none of them was significant. But in this study, we analyzed 24 risk factors, including frequency of eating out and at home. Toxoplasmosis in Somalia. There are very few research on seroprevalence and risk factors were conducted on hospitalized pregnant women only. Data about parental health and immunocompetent individuals is missing in the library of the counter since 1988. The cross-sectional study was designed to determine the associated risk factors with the seropositivity of Toxoplasma gondii among parental health females of different ages, education level, households, and districts of Mogadishu are the most vulnerable group at the risky subsequent congenital toxoplasmosis. 24 risk factors were analyzed and discussed. Methods, ethics. This study was approved by the Ethical Committee of Abrar University for data collection, analysis, and presentation, and all participants were considered. Mogadishu, the capital Federal Republic of Somalia, females, most of them are young, are almost 50% of the population. A cross-sectional study was carried from November 2022 to August 2023. A convenient sample of females greater or equal 9 years from different districts, level of education, and households were voluntarily included in the recent study. Data collection, blood for serum in addition to the participants' socio-demographic data, awareness, hobbies, and gyno history, feeding and dining habitat, water, or domestic or stray cats experience. Laboratory work. We used clean serum sample were removed from the clotted blood tube to obstructed tube and frozen 20 degrees centigrade until use. Serological diagnosis of Toxoplasma gondii was performed for detection of both immunoglobulin G and immunoglobulin M antibodies in the laboratory of Abrar University, Mogadishu. The samples were analyzed using a Toxo IgG IgM rapid diagnostic test. Data analysis. The collected data was stored in Excel sheet, jacket, labeled, and analyzed using SPSS version 25. Chi-square test and logistic regression were used to assess the association risk factors with the seropositivity of Toxoplasma gondii infection among the participants. The 24 risk factors were analyzed using bivariate analysis, and 13 factors which were entered to the logistic regression model to determine the main risk factors. A variable considered statistically significant when the p-value is less than 0.05. Result is, the general result is, we examined a total of 150 females of different ages from household Holy Quran centers, schools, and university participants from 6 over 18 districts of Mogadishu. The overall mean age of examined females was 23.13 plus or minus 7.73. All the participants do not eat raw meat, and 4 of them do not eat meat. The overall seroprevalence of Toxoplasma gondii among the examined females was 46.0%. The seropositivity samples showed only the line of IgG, no IgM was demonstrated among the tested females. 4 over 24 risk factors were significant in univariate, and only 1 was significant in the multivariate. Let us continue the results. This table showed the seropositive females were insignificantly older than the non-infected ones, as you can see the table. The differences of the seropositivity between the districts are also insignificant, as you can see the table. The seropositivity of Toxoplasma gondii and the demographic factors clear difference, but insignificant the seropositivity in married females. Also, you can see the table. And seropositivity of Toxoplasma gondii and the feeding habitat factors highly significantly higher seropositivity among females who only sometimes eat at home, and lower seropositivity in those who never eat outside. Also, you can see the table. The final multivariate logistic regression, it shows that females who only sometimes eat at home was 12.5 times more likely to be exposed to Toxoplasma gondii compared to the one who always eats at home. Also, you can see the table. Discussion. The study was unique in targeting only apparently healthy Somali females, including young, single, and not pregnant ones, healthy future gynecological records, since 54% were seronegative. None of the 17 analyzed risk factors by Hassan show a significant association with Toxoplasma gondii in Somalia. We analyzed 24 factors, and we reported 4 significant factors, and we determined eating out as the main one. Similarly, observation about toxo and eating out were reported in university students from Kingdom Saudi Arabia. Few of our participants have domestic cat at home. However, most of them declared that they have seen stray cats in the streets, restaurants, and work sites. to be disrupted by stray cats around the table of some restaurants in Mogadishu is a normal view of eating out. Stray cats get raw meat during food preparation in these restaurants. Okay, we concluded that. Okay. Recommendation. We recommended that control of stray cats because we cannot stop eating out, but we can control stray cats in these restaurants, streets, and work sites in Mogadishu. Also, we can implement in food safety regulation and reinforce public awareness. Thank you, everyone, and thanks.